If you or your spouse will continue to work past the age of 65, you may be wondering if you should keep your employer group health plan instead of enrolling in Medicare. In this situation, we're often asked questions like, how do I compare my employer group health plan to Medicare? Which is better coverage? What if my employer is offering a Medicare Advantage plan? In this video, I will take you step by step through how to compare group health insurance plans to Medicare. Comparing a group health plan to Medicare is not really very difficult once you know how to do it. You don't need to read line-by-line comparisons of costs based on some hypothetical medical event. In addition, I've created a comparison calculator that will help you better compare the costs and benefits of your employer plan to your Medicare options. So stay tuned. Hi. If we haven't met yet, I'm Matthew Clausen with MedigapSeminars.org. We're an independent insurance broker helping people with their Medicare and retirement needs from Hawaii to Virginia and Alaska down to the Florida Keys. We are a true independent insurance broker. That means we work with all the major insurance companies and offer all the Medicare supplement plans available in your area. Most of all, we represent your best interest, not that of an insurance company, and our services are free to you, the consumer. Check out our 5-star ratings and then contact us. You'll be glad you did. None of us know which exact medical services that we may need in the future, and that's why trying to evaluate a health plan based on hypothetical ailments isn't very useful. Instead, it's best to step back and first understand why health insurance is important. The objective of health insurance is to make certain that a medical event never becomes a financial catastrophe. Because of this, the most important feature of any health plan is the annual maximum out-of-pocket limit, or your MOOP for short. The MOOP is your maximum financial liability in any one calendar year. It's also a great measure of the depth of your insurance coverage. No matter what medical event happens to you, that MOOP will be the most money that you will be liable for an inpatient or outpatient health care. Obviously, an insurance plan with a lower MOOP is more insurance coverage than a plan with a higher MOOP. To compare plan benefits, the calculator that I created assumes that you have a medical event that costs a total of $10,000. Sadly, this is not an unusual sum of money for a major health event. The objective is to show you how much money that you can expect to spend out of pocket with a $10,000 medical event, and then show you what the insurance will cost you. And that's the information that you need to compare plans. You can find the comparison calculator on MedigapSeminars.org. It's part of the drop-down menu found under the Resources tab in the upper menu. This calculator is designed to compare your healthcare coverage to having original Medicare plus one of the 3 most popular Medicare supplement plans, either a Plan G or Plan N or a high-deductible supplement plan. You can also use it to compare a Medicare Advantage plan to a supplement. I should note here that you will get the most out of this information if you already have a working knowledge of Medicare and the most popular supplements available to you, as well as the difference between a Medicare Advantage plan and a Medicare supplement. Now, I will have 2 videos linked, I believe, above my left shoulder here if you wish to learn more about Medicare and the supplement plans. Next, let's go over what information that you will need to have at your fingertips to use the insurance comparison calculator, and then I'm going to walk you step by step through the process. Before we get to the rest of the video, I'd like to ask you a favor. If you find this information useful, please click on the like button below. To be among the first to see my new videos when I publish, please also subscribe to my channel. I can assure you, you won't want to miss out on some of the videos that I have coming up. Of course, if you have a question or a comment, please leave it down below as well. Back to the information that you'll need to have at your fingertips. First, regarding your group insurance plan, you'll want to know the amount of the annual deductible. The deductible is the amount of money that you must pay towards medical bills before your insurance company pays any benefit. If you're comparing a family plan, use the maximum household deductible. Input that amount into the calculator. I'm going to use the average group plan deductible of $2,000. Second, if your plan has an office visit copay, insert that as well. The calculator assumes 6 office visits in a year, which is more than the average person when healthy, but typical when a person is having a bad year health-wise. I'll use $25 per visit. Next, once a health plan is past the deductible, there's usually a coinsurance or cost share feature. The insurance plans seldom pay 100% of your health care after you've met the deductible. A common coinsurance is 80-20, where after the deductible, the insurance company pays 80% of your medical bills and you pay 20%. In that case, your coinsurance is 20%, which is what we'll use here. Keep in mind, your coinsurance may be different. Last for your group plan benefits is the MOOP, the annual maximum out-of-pocket. Now this should be easy to find. It's typically near the beginning of your summary of healthcare benefits. I'm going to use $5,000 for this example, but a range from $2,000 to over $10,000 is not unusual depending on your plan. There's likely a different MOOP for an individual versus family or household. If you're comparing Medicare for 2 versus an employer plan for 2, use the MOOP for the household. Now let's move to the left-hand column. You will need to know the deductibles for Medicare Part B and Part A, the Part B monthly premium, and the Plan G or F high deductible. If you do not have that information at your fingertips, let me show you where you can get it. Simply go to MedigapSeminars.org and click on the Resources tab on the menu across the top of the page. In the Resources page, you'll find the information that you need within the first 2 choices. There is the Medicare Part A and B plus IRMA, and this is where you will find the Part B annual deductible and the Part A annual deductible. Actually, the Part A is a per event deductible. And on the last page is where you will find your Part B premium and what it will be if it's adjusted due to your income. That's the IRMA amount. You can print this out or save it or share it as needed. Next to the Medicare information is the table of Medigap benefits. Here you will find the Plan G or F high deductible amount. FYI, the high deductible Medicare supplement deductible is also your maximum out-of-pocket for that supplement. In this case, it's $2,700 for 2023. This will change each year along with the CPIU measure of inflation. And those amounts are already plugged into the calculator. The last few pieces of data we need to input are the plan premiums. If you haven't already, I strongly advise that you submit a free quote request to us and we'll email you the premium quotes for the Medicare supplement plans that we recommend in your area. There are no family plans with Medicare. So if you want to consider your spouse and possible discounts that you're going to receive as a couple, we will need the information on both of you. And by the way, some insurance companies in some states offer a discount just for being married, even if your spouse doesn't get a policy. So in this case, I'll use an employer plan monthly premium of $150, then plans G and N and the high deductible based on a 65-year-old male in an average cost state. We have $115 a month for Plan G, $95 a month for Plan N, and $40 a month for the high deductible. So what do we get? Well, let's start with the out-of-pocket medical costs for the employer plan. In this example, with the employer plan, a $10,000 medical event would mean paying the $2,000 deductible, $150 in office visit copays, and then $1,600 for coinsurance, reflecting the 20% that's due after the deductible is paid. And that's a total of $3,750 in medical bills. What did it cost to reduce the $10,000 in medical bills down to $3,750? With a regular employer plan that costs just $150 a month or $1,800 for the year. If the employer plan is a group Medicare Advantage plan or a small employer plan that requires you to be enrolled in Medicare Part B, we must add the monthly cost of Part B, the Part B monthly premium. This would increase the annual premium cost to you, leaving you with $3,779 in total annual premiums. By the way, this is my first version of this comparison calculator, so please let me know if you find it useful in the comments below and easy to use. And if you have any suggestions for any changes or additions, please let me know. It's designed for you. Of course, feel free to share this with others that may also find it useful. Thank you. Let's look at Medicare plus a Plan G or Plan N supplement. With Plan G, you would pay the $226 Part B deductible. That's the amount for 2023. And the same with Plan N. With Plan G, the Part B deductible will be your entire obligation. Your maximum out-of-pocket is the amount of the Part B deductible. With a Plan N, we must also add in the $20 office visit copays. Also, with the Plan N, we will assume that you do not have excess charges. As an aside, excess charges are extremely rare and easy to avoid. There's some false information circulating in some YouTube videos, so let me clear that up with laying down some facts here. Fewer than 2% of doctors that accept Medicare have a contract that allows them to charge an excess charge, but it's optional. Of that 2%, nearly half are in the mental health industry. That means for most of us, only 1 in 100 doctors are allowed to charge an excess charge. Even then, it's negotiable. According to Medicare's own statistics, 99.6% of the bills that are submitted from doctors that can charge an excess charge do not include an excess charge. Now, I also know of no major hospitals or medical facilities that charge an excess charge. If you know of one, please put it in the comments down below. We'll look it up and I'll put it out so everybody can see. And it should be public and on their website. They are required to inform you by making it public on their website. Now, there are no excess charges for emergency care and there are no excess charges for inpatient care. Although you can easily look up a Medicare provider on Medicare.gov and find out if they charge an excess charge, there's another very easy way to find out. Medicare providers that charge an excess charge will ask you to pay up front. If a doctor asks you to pay your medical bill up front, that's a doctor that charges an excess charge. I could go on, but the bottom line is that you will likely go through your entire Medicare experience without ever running into a doctor that charges an excess charge. And that's why we do not include excess charges in this calculator. Looking at the Medicare Supplement Plan G and Plan N, they will lower your $10,000 Medicare bill down to just $226 or $346 respectively. What will it cost for such coverage? Just over $3,000 per year in total Medicare and Medicare supplement premiums. Now here's where I may have disappointed you. If you were expecting at this point an alarm to go off with flashing red lights and an arrow pointing to the best plan, that's not what this calculator does. What it does is provide you with a cost-benefit analysis to help you make a decision based on what you value most. Would you rather pay $1,800 a year in premiums, knowing that when you get sick you must pay thousands more in medical bills? Or would you rather pay more in premiums but never have to worry about a medical bill? It's a fair question, and the answer will be based on what you value. Keep in mind, this example is just a $10,000 medical bill. Major events like cancer or many chronic diseases can have a much higher Medicare bill, which will quickly reach your annual maximum out of pocket. If you get seriously ill or injured near the end of the year, your medical costs can overlap into the next calendar year, which will reset your MOOP, your maximum out of pocket, that you may have to pay all over again. That happens quite often. The last piece of important information that you must consider are your prescription drug costs. Drug costs are not included in your plan MOOP. I strongly encourage you to go to PartDshopper.com, the website that I've created to help you find out exactly what your prescriptions will cost with Medicare. I have that linked below. You simply input your current prescriptions to find the lowest cost plan. And by the way, in the years ahead, Medicare Part D will also have a maximum out of pocket. In 2024, there's an expected limit of about $3,300, although as I understand it now, that total may be impacted by the types of prescriptions you have. In 2025 and beyond, there is a maximum out-of-pocket spending cap of $2,000. Use PartDshopper.com to compare your current plan to Medicare Part D. And if you are looking on the PartDshopper.com and your specific prescription is not found, it may be covered under Medicare Part B, or if it's some of the drugs that predate the FDA, it's possible that they won't be covered by Medicare. Lastly, if your spouse is under 65 and you must use under 65 marketplace health insurance plans, you will want that price information too. For most people, that may cost more than Medicare. So that's it. Now just gather the information you need and give it a try. Please let me know in the comments below if this calculator helps, if you find it useful, and please press the like button and subscribe to see others' videos like this one. Help me get this video out to all who could benefit from it. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.